Thanks very much, Ben. Yes, my name's Natalie. I lead an initiative called Understanding Patient Data, which is hosted at the Wellcome Trust. That's a big charitable foundation based just in Euston. And the aim of understanding patient data is to try and make the ways that patient data is used a bit more visible for people, more understandable, and more trustworthy. And I'm sure for many of you, before you've been on this journey, probably didn't really think much about data. Data's not the most exciting word, I have to admit. Sorry to everyone else on the panel. But for many people, it's not something that's salient or prevalent in their day-to-day lives. And we try to create resources and do research to find out what people actually really think about health data use, but also how we can try and push to ensure that the policies, the governance, the rules, the decision-making about what happens to that data and how are actually worthy of you having trust and confidence in them. So participating in this event has been absolutely fantastic from my perspective. And I just wanted to pick up on how much the insights that you've come up with resonate with other research that we've done around the country, or that we've collated and pulled together, because I think very often it's the case that at the start of this sort of discussion and conversation, your initial reaction is, what on earth are you talking about? I had no idea this was going on. And unsurprisingly, for many people, that creates quite a lot of anxiety. But it's really fascinating to see that as you discuss and learn more and have the opportunity to ask questions and explore what's actually happening in practice, you know, the statistic about people wanting this data to be used and saying it must be used to help improve care is phenomenal, and it's really powerful. And I think that's a really good example of when you actually go through the process of talking about this stuff and finding out what happens in practice, it can really counter that slightly dominant negative media narrative, which tends to be things like scary headlines about data's being sold, or insurance bosses have got hold of it, or Google's got your medical record, which are the sorts of things that sometimes you can see in the media. So actually going through this process shows, you know, you can really create brilliant insights and engagement when you take the time to actually talk to people about it. And the other thing I just wanted to highlight really is that, especially to the policymakers, you can talk to people about this stuff. It feels controversial and it feels scary. You've got NHS data, patients' data, very, very precious to you all as individuals, and you're talking about things like companies maybe using it. It's controversial, it sounds scary. And for many policymakers, they'd rather not go there. They'd rather kind of get on with it, do it behind closed doors, say, we don't want to talk to people about this, it's too complicated, it's a bit scary. But look at the process you've gone through and look at the fantastic, sensible, insightful recommendations you've come up with. I think this One London event is a real example of just how you can take people on this journey, go through this process and come up with some really fantastic, brilliant, helpful, sensible, practical insights. And from my perspective, I think this is the sort of thing that should be done far more in more places beyond London.